Welcome back, dear viewers. We've been joined here in the series of AziadiQ8 with our special guest, Dr. Faisal Alhajeri, consultant urology. Of course, it's a pleasure to have you here in the series of AziadiQ8, Doctor.
It's all my pleasure to be here again, and I hope to be a light guest.
Of course, you're always enlightening us on different subjects. Last time we were talking about kidney disease, and today we would like to know more about urinary tract infection, the causes, the factors, the risk, all about it.
So, urinary tract infection is one of the commonest disease that we're facing in our clinic. It's more common in female than male, and this because of the anatomical constitution of the urinary system in female. If we're comparing the urethra, which is the tube connecting the bladder to the outside for the urine, to let the urine outflow, in female it's a 4 centimeter length, while in male it's around 20 centimeter length. So, and the other thing that in female it's sharing other structure, for example the uterus and the rectal. So those three, or this factor, anatomical factor, can be a leading cause of UTI infection in a female. Now, what other risk factors that can lead infection in a male or a female? One of the things, it's the amount of fluid intake per day. In our country, in the Gulf area, as you know, it's a dry climate. So less water intake will be in the opposite, a risk factor for UTI, because it will be a risk factor for stone formation. Another thing, that if something obstructing the urinary tract, for example, on those above 50 in male, if there is a big prostate, and the prostate is the male gland that helping during for the fertility, with age at almost at 50 start to grow up and become more atrophic, so it will compress the urethra. This will lead to less urine outflow, and this might cause infection.
So it's very important to stay hydrated, because we always say this to our dear viewers: stay hydrated, drink water as much as you can. As you mentioned, and it's in the Gulf area, in Kuwait especially, because we have heat and humid weather, it's very important to hydrate, because as you mentioned, I think this is very important for the UTI, especially if you don't have enough liquid, enough water in your body. It's going to have a lot of infections.
Yes.
And I think we're going to be back to talk more about it after this short break. So dear viewers, let's take a short break and we'll be right back. We're back, dear viewers, with our guest, Dr. Faisal Alhajeri, consultant urology. Of course, we were talking about the concept and the terminology of urinary tract infection, and we'd like to know more about the complication of UTI and how to prevent it.
Well, now, as you know, that urinary tract infection has two impacts. One of the impact on social life, on your life. As we know, symptoms of urinary tract infection, the simple urinary tract infection, including frequent urination, urgency, that the patient will feel that he has the urge to go toilet right now, as well nocturia. Nocturia means that he will wake up at night maybe twice or 3 times just to go to empty his bladder. So this, from one side, it has impact on my daily life, my social life. Some will be impressed to go out for gathering, for any, because he's always in need for the toilet. So this is one thing. The other thing, that it might complicate it with ascending infection. If we say that the infection starts in the bladder, it might goes up to the kidney. So this will cause serious complication. Sometimes it causes scarring of the kidney. This is from one side. Now, how to prevent UTI or urinary tract infection? For female, we always advise them that usually, and even for male, don't wait till the last point. Some will escape the toilet. I'm not going to toilet now. I want to see the movie, or I want to see something. I'm going to stay a little bit.
They delay it.
Delayed it. Okay? So whenever you have the sensation, you have to go toilet direct. This is one thing. Other thing, drink plenty of water. Water. Number 3, for our sisters or females, that the underwear fabric might play a role in infection. Those containing nylon or polyester, okay, has high risk of UTI. Okay, it might cause urinary tract infection. The other thing, using sometimes wash or soap, this can also change the pH of the area, of the urinary area, and this might destruct the beneficial bacteria, okay, instead of harmful bacteria. So we always ask them to, if you want to wash with water, no soap, no chemical for this area.
Of course.
One more thing for our, again, female, that after the postmenopause, they have high risk of UTI. So they have to see a gynecologist once they have a postmenopause, because sometimes this area will be dry. They might need some medication, like the hormone replacement therapy.
Of course, and when we talk about the urinary bladder, so I'm sure there's a lot of causes that causes the bladder to have tumors. So what causes the bladder to have tumors? Because we'd like to know more about it, because as you mentioned, for the UTI, it has a lot of different factors. But when it comes to bladder tumor, what causes it?
Well, bladder tumor is a serious disease. We have to know that it's a cancer. When I say the bladder tumor, means a cancer disease affecting the bladder. The most common risk factor for such thing is smoking. According to all studies, smoking has 3 to 4 times higher risk for bladder cancer than non-smoker. Now, what else? Sometimes you know that women, they like to use color for the...
They dye their hair usually.
Yes, and some of the product may contain some materials that might goes and absorbed by bladder and might be a risk factor for cancer.
Of course.
In countries like Egypt, where bilharzia, schistosomiasis is a parasite infection, they might have a risk of bladder cancer.
So we really need to watch out when it comes to the ingredients and the hair coloring products, because this could cause bladder infection, as you mentioned. I think everything we have to put in our body or our hair or our face, we really should read about the ingredients more. And when it comes to overactive bladder, what causes overactive bladder?
Well, overactive bladder means that the bladder will be irritable. And this might be secondary to, for example, diabetes. Uncontrolled diabetes might affect the nerve supply to the bladder, and this might cause irritable bladder. The patient will have frequent visits to the toilet during the day, urgency, nocturia, as mentioned before. In addition, they might have urge incontinence. What urge incontinence means, that during the feeling of urge to go to the toilet, if they couldn't reach the toilet, they might lose some drops, or they cannot control the urine. One of the things, as I told you, it can be diabetes, a risk factor. Other, if there is an injury to the spinal cord, sometimes disc prolapse at the lower level, or recurrent infection.
Of course, and we really need to watch out for recurrent infection, as you mentioned, and all of these symptoms really show you that you really need to go and visit a urologist as soon as you see any kind of these symptoms that we mentioned earlier. And when it comes to the symptoms among the male population, so when they are required to visit a urologist, because I think, as you mentioned, a female usually have a lot of UTI, more frequent than male. So what is the difference between a male and female when it comes to visiting the urologist?
As I told you that UTI, for example, more common in female than male. So if I say that I'm seeing in my clinic 10 females with UTI, I might see one or nothing from male. And this because of the anatomy of the urinary tract system in male. Now, we don't say that the male are saved. They have other diseases like enlargement of prostate. This coming with age. The patient will have weak flow, that he will say that the flow is not like before. I'm taking longer time in the toilet to empty my bladder. I might go frequently to the toilet or wake up at night many times to go toilet. Sometimes they will have that the pattern of urine became intermittent, not continuous. It stopped and again flow.
Of course, and this happens with age.
This can happen with age. If it's above 50, the prostate will enlarge. And one more thing, that it can be also sign of prostate cancer. That's why we always advise male at age of 45 or age of 50, if you don't have a relative diagnosed with prostate cancer, you have to do a blood test called PSA, just to detect if you have a prostate cancer or not.
Of course, and doctor, when it comes to these kind of tests, I'm sure everyone would like to know more about them. So even if you don't have the family member who has any type of diseases when it comes to the bladder or the UTI, so how frequently should you go and visit the urologist?
Okay, so if you reach the age of 50, you have to do it, the PSA, once, and next year again, and then you might wait 5 years or 10 years to do another test. You don't need to spend money every year on urologist. That will make my pocket heavy. Okay, you can come in once or twice, and that's all.
Of course, I think that's very important. So as soon as you visit, it's going to be like every year, and then after that, 5 years after, because that way you can stay safe and check up on yourself. But I think the best way to do that is like every year. So just in case you face any kind of diseases, it's even more assuring for yourself.
Yes, of course.
Of course. And doctor, is there any last word you would like to share with our dear viewers watching today?
Well, I prefer always to say that drink enough water in our sweet country.
Thank you so much, Doctor, for your time. It's a pleasure to have you here in the studios of Hala Kuwait.
Thank you.
Dear viewers, you had with us Dr. Faisal Alhajeri, consultant urology. Let's move on to our next report. It's about Quran memorization competition. Stay tuned.